Hey everyone, it's Nurse Mike here from SimpleNursing.com. Today we're going over therapeutic communication, how to connect with patients and ace those NCLEX questions. And as always, for my Simple Nursing members, be sure to grab this communication study guide inside the membership area and let's talk it out. This is defined as a face-to-face process of interacting with clients and their family members that allows them to express their own thoughts and feelings in order to build trust. Now, textbooks will always recommend open-ended questions and close-ended comments. So, open-ended questions are those questions that are not simply yes or no questions. They instead require a response that is not simply yes or no. So, this promotes discussion with the patient. Now, closed-ended comments are like stating facts that are used to portray empathy and build trust, as well as assess further. So Hezi mentions, open-ended questions select all that apply. How do you cope with anxiety? What event in your life has been the most stressful? Can you please tell me more about what's happening to you that led you to be hospitalized here? So as you can see, all these questions are not simply yes or no answers. They require the patient to converse with the staff. So let me show you how this works. For example, say a client presents to the hospital after a suicide attempt. As you can imagine, the family and the patient will be emotionally in turmoil. So remember, the goal here is to, number one, build trust. So the two NCLEX tips to write down is number one, ask and assess emotions. This is done to obtain important information. So for example, tell me when you started noticing, or tell me what concerns you have. What are you feeling right now? How are you feeling about your baby? So using these broad, open-ended questions will help uncover and assess important information, which will help decision making. Now, number two, our second NCLEX tip, is always state the facts to build trust and reflect on how the patient feels. So for example, we have the vital signs under control. This helps to build trust with worried family members. Or you must be very upset after experiencing this. Or I understand you are worried. This portrays empathy. All we're trying to do is state the facts that's going on. For example, you sound very discouraged and scared. Or you sound angry. Anger is a normal feeling associated with loss. Or it can be a combo effect, which we saw a lot on our NCLEX review. For example, this experience has been very overwhelming for you. What are you feeling right now? So you can see how the facts are stated and a question is asked, but it's open-ended, not a simple yes or no. And another example here. Clients with cancer experience fear of dying. Tell me about your concerns. So you can see, we ask and assess emotions, and we state the facts. Now, the big things to avoid here, the non-therapeutic communication. So, huge NCLEX tips. Do not offer opinions or advice, or even personal experiences. For example, never say, I know how you feel, or I too had a miscarriage, or even, I also had breast cancer. The second thing we don't do is minimize the client's feelings. Remember, we want to show empathy. We just don't want to make the feelings smaller. Number three is we never leave the room. No. Never leave the room. Always stay with the client to show support, even use therapeutic touch to show empathy. And a huge one right here. Never give false reassurance. Huge NCLEX tip. So write this down. Never say, everything's going to be all right, because you don't know that. And never say, I'm sure you will do the correct thing. Remember, never do this. This does not build trust by assessing emotions, and it doesn't state any facts. It simply applies an opinion with no certainty. So stay away from opinions. Now, another thing to stay away from is never ask why. Another big NCLEX tip. Well, why though? Well, why questions are always avoided on the NCLEX, since clients typically view this as judgmental questions or even intrusive speech, which destroys not only the nurse and client trust relationship, but it results in the client getting very defensive. So never ask why.
For example, why do you feel angry when? Or why do you act this way? Or even, why did you leave your child alone? So remember, never ask why.
Now, pulling from our Simple Nursing NCLEX question bank, written by the people that actually wrote the NCLEX. Here are the top missed test questions.
An elderly client loses their spouse to pancreatic cancer. Choose the most therapeutic response. Select all that apply. Okay, now before looking at the options, remember to ask questions and state the facts. Those two things. Always assess and then state the facts. So option 1, leave the room to allow the client to grieve in private. No, always stay with the client to show support. So watch out for the key term, leave the room. We never leave the room. Stay with the client. Now option 2, the nurse states, I recently lost my grandfather to cancer, so I understand what you're going through. Now, this one is tricky, but it's technically wrong. Do not give your own personal experiences. This diminishes the client's emotions, so don't get tricked. Now, option 3, I know this is a difficult time for you, which it is, that's a fact, yes. Tell me how you've been coping with this. Yes, you stated facts and you asked questions. This is therapeutic communication. Now, option 4, what are your feelings and thoughts about attending a support group? Yes, we're asking questions and we're offering recommendations here. Now, option 5, it takes time to heal with and come to terms with a lost spouse. But it will be okay. Man, so close, but so far. Now, the question or the option started correct. It takes time to heal and comes to terms with a lost spouse. That is true. That's a fact. But it will be okay is false reassurance. So this is incorrect. And the last option here, option 6, why do you feel sad? No asking why. So just throw that question out. Anytime you see the question or even the option why, just toss it out. Okay, now we're going to go over a lot more examples, but first, a little side note here for your nursing exams to clarify some various terms and techniques of therapeutic communication. So asking questions helps to explore emotions and gather more information. This encourages the client to discuss relevant events and even feelings. Restating is repeating the patient's words to confirm what you understand. And reflecting returns focus on the client. Now, the second thing, we talked about stating facts, voicing doubt and presenting reality. This refutes misconceptions or even delusions without confronting the client's beliefs, especially true when communicating with schizophrenic patients, which we have a few examples in a moment. And lastly, suggesting resources or strategies helps to offer guidance. For example, recommending that support group, like in our question before. Now, I wouldn't focus on these terms too much or get hung up on the memorizing them, since exams and the NCLEX will have questions directly on responses and not technically on terminology. So let's give a few practice questions from the top tested textbooks here.
Looking for more tips and strategies for questions like the ones we just covered? Well, our Simple Nursing membership includes exit prep lectures and thousands of questions across all nursing school and NCLEX topics.
So Hesse mentions, what is the most helpful nursing response to a patient who reports thinking of dropping out of college because it's too stressful? Well, school is stressful. Yes, you stated the facts. What do you find most stressful? Cool, asking a question. We got our 2 items there. Now, question 2, which statements will the nurse indicate as therapeutic? Select all that apply. Am I correct in restating that you are feeling less anxious today? Yes, that is pretty much restating. That's the key term there. You're stating the facts and restating what the question or what the client has just said. In looking back at what you said, you stated you are feeling better. Yes, that is restating. Help me understand what you're feeling today. Yes, we're assessing the client. So remember those 2 items. State the facts and ask questions. And question 3, A man was killed during a robbery 10 days ago. His widow cries spontaneously when talking to the nurse. What is the most therapeutic response? The sudden death of your husband is hard to accept. Yeah, that's a fact. Tell me about how you are feeling. Yes, that's a question. So stating the facts and asking questions. So Kaplan mentions a client with end-stage heart failure says, "Why can't this just end? I'm no good to anyone anymore." Which response is best? This must be difficult. Stating the facts, please tell me about your feelings. Cool, open-ended questions there. And question 2, the nurse finds the client crying and says, "What do you want? Go away. You can't help me. I hate you and I hate myself." It sounds like yourself after a failed exam, huh? Well, which response by the nurse is best? "You seem to be in pain." State the facts. "I'll stay with you for a while." Now, this is really tricky, right? Because the client just said, "Go away." But really the correct option is to always stay with the client. Now, question 3. The client's spouse has been unemployed for 6 months and is afraid of not being able to pay the rent. Which response is most appropriate? You're worried that you won't be able to pay the rent? Well, yes, you're stating the facts and we're also restating the problem. Now, ATI mentions, "I am really concerned about my mom." Which of the following responses should the nurse make? Tell me what is troubling you. Yes, you're drawing information out of the patient. The second option is tell me about what you're feeling right now. What is upsetting you? Yes, always assess and never ask why it's upsetting you. And lastly, it seems you feel responsible for what happened to your mother. Yes, stating the facts. Now, question 2, the client who has cancer is scheduled to receive chemotherapy. She wants to try homeopathic treatments first. Which of the following responses should the nurse make? Tell me more about your concerns about taking chemotherapy. Yes, we're having the patient open up to us and we're assessing emotions. And lastly, question 3. A parent who recently lost her child states she cries frequently and can't bear the loss. Which therapeutic statements should the nurse make? You are feeling great pain at the loss of your child. Yes, stating the facts. Now you can see how easy these tricky questions can be. Always ask questions and state the facts. Now lastly, Saunders had a lot to say as well. So let's practice these. "I can't believe my wife died yesterday. I keep expecting to see her everywhere I go in this house." Therapeutic nurse response: "It must be hard to accept that she passed away." Yes, state the facts. Now, question 2, this condition is just another nail in my coffin. Which response by the nurse is therapeutic? You seem very distressed over learning you have asthma. So yes, once again, state the facts. And lastly, question 3, a client diagnosed with terminal cancer says to the nurse, "I wish my family would stop hoping for a cure. I get so angry when they carry on like this." Which response by the nurse is most therapeutic? You feel angry that your family continues to hope for you to be cured. Yes, we're stating the facts and we're restating what the patient just said. Okay, if that's not enough practice for you,
Make sure to pull out this study guide for this section so you can follow the key points.
then watch this next segment from our schizophrenia video.
Now, switching gears to therapeutic communication. This is always the most tricky questions on exams and even the NCLEX. Now, we have a full video on therapeutic communication in our mastery course, but let's deep dive specifically for our schizophrenic patients. So first things first, assessment. We always ask open-ended questions, especially when clients are having delusions that people are trying to hurt them. So open-ended questions are basically any question that doesn't end with a yes or no answer. So for example, what are the voices saying to you and what do you see? This actually was an NCLEX question, so I'd write this one down. You see how this question is open-ended. It doesn't end with a yes or no answer. It deeps dive into a deep assessment. So Hesse mentions,
Tell me what you're feeling at this moment. Describe what you are seeing now. You see how deep we're going into this assessment. And Kaplan mentions, how does it feel to think you are being watched? And ATI, what activities did you enjoy in the past? See how each question is an assessment. So to help you put into more context for an exam question, let's do a Kaplan full question. Do you see those cameras in the ceiling? I'm being watched all the time. Which response by the nurse is most appropriate? Those are the sprinklers in the ceiling that come on if there's a fire. How does it feel to think you are being watched? Yes, this presents reality and acknowledges feelings. Next, we always state the facts. To build trust, we present reality. And to show you acknowledge the client's feelings. Huge. So, for example, I see you're frightened. Let's go to your room and talk about this. Huge NCLEX tip. This actually came up on a few questions during our NCLEX review. Now, Saunders mentions, it might be frightening to think that others want to hurt you. So, we are acknowledging the client's feelings. And Kaplan, I don't hear any voices, but I know they are scary for you. So yes, this states the facts and acknowledges the client's feelings. And Hesse, I understand the voices are real to you, but I do not hear them. Or you see yourself as the savior. I see you as my client. Now, as you can see, all these statements state the facts and acknowledge the client's feelings. So to help you a little bit further, let's see all these statements in action here. Hesse mentions, a client with paranoid schizophrenia refuses food, stating the voices are saying the food is contaminated and deadly. A therapeutic response for the nurse would be, I understand that the voices are real to you, but I do not hear them. And a Kaplan question. There are really strange people in the corner of my room laughing at me and saying horrible things. Which response by the nurse is best? I don't hear any voices, but I know it's frightening to you.
Thanks for watching. Did you know you can unlock beautifully handcrafted study guides, packed with key points and memory tricks from all our videos? Plus, you'll get access to over 1,200 exclusive videos not on YouTube, all neatly organized by nursing school topic, to make that complex nursing knowledge actually stick. You'll also gain thousands of practice questions written by current professors and actual NCLEX writers. So for access to all this and more, click right up here or visit simplenursing.com. And don't forget to subscribe to our YouTube channel. Happy studying, and we'll see you in the next videos.